Hi friends, welcome to Pharma Discussion. As the world is witnessing the pandemic of COVID-19, the medical community is racing to find a cure. One such treatment that's in focus right now is convalescent plasma therapy. So several countries, including India, are seriously looking at this plasma therapy as a potential treatment for COVID-19. So today, in this COVID updates, Pharma Discussion is discussing about plasma therapy, and we can connect to the plasma therapy after discussing some fundamentals of immunity. And you know that immunity is resistance exhibited by the host towards the injury caused by the microorganism or their products. The process of developing immunity is a multi-step process, and it takes over 1 to 2 weeks for developing this immunity. So suppose when this coronavirus enters the host cell, the body responds to the viral infection with an immediate, non-specific, innate immune response. And you know that innate immunity means the immunity an individual possesses by birth, by virtue of its genetic constitution. So, upon a viral infection, the body responds immediately with a non-specific innate immune response by releasing some cytokines, some interferons, and all these will slow down the multiplication of virus in the host cell. So in this figure, it is very much clear that dendritic cell, macrophages, and neutrophils are mainly involved in innate immunity. So this innate immune response is followed by an adaptive or active immune response where the cells of adaptive immunity, mainly B lymphocyte and T lymphocyte, will interact with the viral antigen. And upon interaction and recognition, the B lymphocyte will make specific antibodies against the virus, and that is called humoral immunity, where the T lymphocyte will recognize and eliminate the cells infected with virus, and that is called cellular immunity. So this combined adaptive and combined humoral and cellular adaptive immune response will clear the virus from the body. So that means if your immune response is strong enough, it will prevent the disease progression and reinfection by the same virus. So some more points we want to add on this active humoral immunity. So as mentioned earlier, upon an antigenic stimulus such as a virus or bacteria, the B lymphocyte will produce specific antibodies against that antigen. In the case of SARS-CoV-2 virus, IgG and IgM, immunoglobulin G and immunoglobulin M, are the major antibodies produced by the B lymphocyte. And the point is, this active immunity sets in motion only after a latent period. There is a lag for working. So during this period, our immune machinery needs some time to set in motion. That's why this lag. But once it is developed, the active immunity is long lasting. So that means if you are an individual who are actively immunized against a particular antigen, so when you experience the same antigen exposure again or a secondary exposure, the immune system will respond more quickly. There is no lag and abundantly than the first encounter. So that means the active immunity is associated with some immunological memory that will prevent reinfection by the same virus. So COVID-19 infection can activate both innate and adaptive immune response, but in severely ill COVID-19 patient, the number of T cells, B cells, and natural killer cells was drastically reduced, and surely there was no antibodies present in their blood against the coronavirus. But in the case of COVID survivors or the recovered patient, they showed a normal level of T lymphocyte, B lymphocyte, and natural killer cell, and also in their blood the presence of specific antibodies against SARS-CoV-2 was confirmed. So therefore, the point is our immunity plays a crucial role from COVID recovery. So how we can get immunized? The most effective method, we know that a vaccination. So a vaccine is a preparation of live or killed microbes or their product that will lead to the formation of antibodies in our body. So this is the most effective method. So the vaccination will provide a complete protection and also it has some immunological memory. It will prevent reinfection or subsequent infection. But you know that the corona vaccine are only in the initial phase of development. It will take considerable amount of time to prove efficacy and also to become available. So therefore, the alternative option is passive immunization. So in passive immunization, we are giving the immunity in a ready-made form. So we are not giving the antigen, we are not giving the antigenic stimulus, and instead of that, we are giving the performant antibodies. So passive immunization will provide an immediate immunity, but it is not long lasting. So there was no immunological memories also associated with passive immunity. The agents used for this purposes, the first one is a hyper-immunized sera of human or animal. So the next is convalescent sera. So the word convalescent means a person recovering from an illness. So therefore, convalescent sera is a serum of patient that is recovering from an infectious disease, and you know that. So therefore, the serum contains high level of specific antibodies against that particular infectious disease. And the third one for passive immunization is pooled gamma globulin. So it is actually the gamma globulin that is extracted from pooled blood of at least 1,000 healthy human donors. So therefore, it contains antibody against all common pathogens prevalent in a particular region. So among the three, convalescent sera and pooled gamma globulin are the passive immunization methods that is mainly used for treating against some viral infection. Now we think, based on the current WHO data, approximately 10 lakh patients throughout the world have survived from COVID-19. So their blood or plasma could be a very powerful weapon to provide highly effective treatment to people who are actively infected with COVID-19. So here comes the importance of convalescent plasma therapy, and the very important point, it's not in the first time. It's not a new concept. It was used for the first time in 1890 for diphtheria, and also it was used in 1980 for treating Spanish flu pandemic, and in 2009 for H1N1 infection, in 2014 for Ebola virus disease, and in 2015 for treating Middle East respiratory syndrome. And now, in light of this COVID-19 pandemic, recently on April 13, 2020, FDA issued guidelines for investigating convalescent plasma therapy. So according to this guideline, the patient eligibility for enrolling the plasma therapy, that is, the patient should be a laboratory confirmed COVID-19 patient who is manifesting some severe symptoms. It may be some pulmonary symptoms or some extrapulmonary systemic infection. And the third point is the informed consent of the patient is very, very important. So next is obviously the collection of plasma. We need some donor. Who can donate the plasma? The donor eligibility. So the evidence of the COVID-19 infection should be confirmed in the donor by means of a diagnostic test at the time of illness or by means of an antibody test after the recovery. And the second point, the donor should be a complete survivor. There should be a complete resolution of symptoms at least 20 days prior to the donation, or a complete resolution of symptoms at least 14 days prior to donation, and also a negative result for COVID-19. And very importantly, pregnant women are excluded from the therapy, excluded as a donor. And the very important thing, the amount of antibody. So the amount of neutralizing antibody should be a minimum of 1:160, but a titer of 1:8 can also consider if an alternative matched unit is not available. So this is the donor eligibility. So after that, we can go to the procedure. So the patient who recover from COVID-19 have antibodies in their body. So therefore, blood is collected from the COVID-19 patient. So next is we are processing the blood. So we are removing all the cells or the blood cells, and we are collecting the plasma or serum which contains the antibody. So here I want to clarify one point, that is difference between plasma and serum. So plasma is actually the liquid cell-free part of the blood that is treated with an anticoagulant. That means there is no clotting in the plasma. So therefore fibrinogen is present in the plasma. But in serum, serum is also the liquid part of the blood that is collected after coagulation. So therefore, it is devoid of clotting factor, or fibrinogen is absent in the serum, or simply plasma minus fibrinogen is serum. So now we collected the plasma or serum, so that is rich in antibody. And the next very important point, serum is more stable than plasma, and serum is considered as the gold standard for biobanking or preservation. So now we are collected, we are processed the plasma or serum that contains antibody, and it should be frozen within 8 hours after the collection and stored at minus 18 degrees Celsius, and the expiry date is 1 year from the date of collection. And we can administer the serum or containing antibody to the patient. So the antibody will circulate the blood, reaches the tissue, and provide protection against the virus. So depending upon the amount and composition of antibody, the protection can last from week to month. And now the evidences. Only 3 published clinical trials are available for convalescent plasma therapy in COVID-19 patient, and the total number of patients is only 19. So therefore, you are sure that they are not proper randomized to clinical trial, and also a very small number of patients are involved in these studies. So therefore, we cannot conclude that the therapy will work on all patients all the time. It's not a proven one, it's still in the experimental stage. But some countries tried this as a compassionate treatment and found effective. The countries include South Korea, US, Italy, China, Canada, or even India. So India's first COVID-19 patient has fully recovered after convalescent plasma therapy and was discharged on April 26 from Delhi, and also ICMR is conducting clinical trial, randomized to clinical trials of this convalescent plasma therapy at multiple centers in India. So we can hope for the best. And now the last one, what are the challenges? There is a lack of randomized to clinical trial to confirm the efficacy. And also there is a risk of transmitting infection to the transfusion service personnel. And also a proper donor is very important. A donor with high neutralizing antibody titer is a major factor in the success of plasma therapy. And also in endemic areas, the risk of other transfusion transmitted infections such as HIV, hepatitis B, hepatitis C, and syphilis is high. And also, as discussed earlier, we cannot assure that the therapy will be success for all time. The therapy might fail for some patient and can result in an enhanced form of infection. And the last one, the antibody administration may lead to the suppression of our body's natural immune response. So therefore, there is a chances of making vulnerable to the subsequent reinfection. So these are the challenges. We can hope for the best. So we are waiting for the clinical trial data for confirming the effectiveness of plasma therapy for treating this pandemic situation. So I think with that, we covered most of the important points regarding this plasma therapy. If any doubt, you can ask in the comment section. We can discuss. So therefore, thank you all. Keep watching us. Please support and subscribe.